topic is insurance and taxes. Multiple tax subsidies are available to many buyers and sellers of health insurance. These subsidies have the potential of creating excess demand for health insurance, which in turn can create excess demand for health services. A review of the literature on the effects of the tax subsidies on the price of healthcare shows that these subsidize by raising prices in the medical sector, constrain the Medicare and Medicaid programs' ability to provide access to care for their beneficiaries. Introduction. With a dramatic increase in the cost of healthcare, much government effort in the last 10 years has concentrated on containing expenditures for Medicare and Medicaid while trying to maintain quality of and access to care for the population served by these programs. These efforts to contain expenditures have largely focused on mechanisms to limit government reimbursement levels for healthcare or to restructure the reimbursement system and have often failed to consider the reaction of the private healthcare market. Given the size of the private market, this is an important oversight. Of the $168 billion spent on personal health care in 1978, 27% was by the private health insurance market and 28% by the federal government by the Gibson 1979. With private third party reimbursement equal to the federal government's share, the private sector is able to exert considerable influence on the cost of care and consequently on who receives care. Basically, the private and federal components of the market compete for the healthcare providers' time and much, but not all of this competition is based on reimbursement levels. For instance, it has been shown that when Medicare and Medicaid fee levels are lower than those of the private insurers. Physicians limit their number of Medicaid patients and their acceptance of Medicare assignment and instead see patients with private insurance. Sloan, et al. 1977 and Periniger 1979. If the government does not raise reimbursement levels to meet those of the private sector, access to care is limited for Medicaid patients and Medicare patients have increased out of pocket cost. If it does raise reimbursement levels, the outlay of funds for federal programs increases. Other research has shown that even with an increase in the federal program fees, the Medicare and Medicaid recipients may not have greater access to care. Hadley and Lee 1978 and Peringer report that raising Medicare and Medicaid fees might exert inflationary pressure on private fee levels, leaving the relative positions of the fees in the private and public sector the same as before the increase. The research cited above suggests that there is an interrelationship between the two market components that should not be overlooked when considering ways to control cost in the Medicare and Medicaid programs. This paper will consider an aspects of the private market, namely tax incentives, which create upward pressure on fees. Specifically, we will argue that by eliminating tax subsidies to the buyers and sellers of private health insurance and thereby creating a more efficient private health insurance market, it would be possible for the government to slow upward price pressure in both the private and public sectors, thus helping to control government expenditures and improve access for Medicare and Medicaid patients. The discussion will focus on how the present tax subsidies may be increasing the demand for the health care, which could be the cause of rising prices in the private market. Through a review of the literature, we can first examine the buyer's market for health insurance, analyzing the health insurance deduction by employers and the health insurance deduction by employees, as well as their effect on the demand for health insurance and health care. Secondly, we will look at the private health insurers market and review the findings on the effect of differential tax treatment of the insurers on the efficiency of the market. The concluding section will discuss options for improving the current private market structure to make public efforts for cost contaminant and access more viable.